Hey everyone, my name is Dr. Michael Wald, the Blood Detective, and here we are again talking about another important topic. This one, young people are dying, and we're going to talk about here's why, meaning they're dying prematurely of conditions that they just have no clue that they're susceptible to. And to make matters worse, our medical system is not educating our young people well enough, not to mention parents and schools. So this is going to be a very brief presentation that is meant to just simply make you aware of what the dangers are so that you can do something about it. So to begin with, I'm a doctor of chiropractic with a master's degree in nutrition. I also have a board certification in nutrition. I'm a dietitian and sports nutritionist. I also provide life coaching to my clients and acupuncture, and I have a medical diploma, but I did not seek an active license to practice medicine. So this information is essential, but it's not meant as a substitute for sound medical or health advice. So please be careful with this information and how you use it. Hopefully you'll use it correctly. So let's begin by talking about heart attacks. When we think of heart attacks, we tend to think of older individuals, and that, of course, is true. The number one cause of death still in the United States for men and women is a cardiovascular disease. But I think in the next few years, infections will overtake it. But either way, this is a big problem. And we know that heart attacks in people under 40 years old are rising by approximately 2% per year, with 1 in 5 heart attacks now in people 40 years old or younger. This is a growing trend, and it's worldwide. So that's very interesting. Maybe it has to do with pollution, but it also has to do with other susceptibility factors like sleep and stress reduction, and of course, diet, exercise. So you need to know this is a big problem. People under 40, and the statistics are growing every year. And what about strokes and recurrent cardiac events? So there are different types of strokes. There are thrombotic strokes, which are caused by a clot, which gets stuck in a blood vessel, and then it stars blood to an area of the brain, and that dies off. That's a stroke. And then there are hemorrhagic strokes caused by excessive bleeding. Maybe I'll do another presentation on different types of strokes and the nutritional things. But what you need to know is that young adults with heart attacks face similar long-term risks, such as stroke and recurrent cardiac events, just like older people do. And that debunks this myth that youth somehow offers some extra protection. That's becoming less and less true. And when I look around, even just on the streets, and I see younger people these days, I'm just shocked at the levels of just frank obesity, overweight, and complete ignorance when it comes to nutrition and health. I mean, I have young people that come in, teenagers, let's say, and younger people, college level people, and all ages, but in the younger age group, I test them and I ask them basic questions about nutrition and lifestyle, and they haven't a clue. So unless you educate yourself on these topics, you're going to find yourself at a disadvantage in terms of increased susceptibility to these cardiovascular issues and other health problems. And to make matters even worse, your physicians are not educating people either. They tend to react once you have the disease. So you need to take responsibility for your own health. You need to educate yourself. You need to know that you're more susceptible if you're a younger individual, and younger these days seems to be around the 40 range, meaning that we're seeing a lot more cardiovascular events than we've ever seen in that age group and below. In terms of high blood pressure and diabetes, we have a rising prevalence of hypertension, which is high blood pressure, diabetes, high cholesterol, obesity, and just overweight. In younger groups, it's just piling up. It's out of control. And these particular problems that I just mentioned are associated with arterial damage, fueling cardiovascular disease. So when we have blood sugar issues and high blood pressure and high cholesterol and these sorts of things, we have damage to the endothelial or inner lining of blood vessels. The blood vessels can become more stiff, which means they're aging. They're not going to react as well to managing blood pressure, for example. The body notices the damage in the blood vessels. It sticks cholesterol in there. Eventually, cholesterol is packed onto the inside of blood vessels and can cause blockage. So these are a pattern of conditions which we're seeing even in single individuals. So what I'm saying is that we see a person, they have high blood pressure, they have blood sugar issues, they have blood cholesterol issues, and they're overweight. We even have a name for it. That's called metabolic syndrome or syndrome X. But you might be saying to yourself right now, oh, well, I only have one or two of those things now, so I guess I don't have syndrome X. That's how it starts. And then eventually you have all three. And once you reach that syndrome X diagnosis, your risk of dying earlier and for a reduced healthy lifespan is dramatic. Let's move on to COVID-19. And what I'm going to say about COVID-19 is true of a lot of other viruses. COVID-19 infections have been showing increased risks of heart attack. So those who have had COVID infections have a statistically higher risk of having a heart attack. And that might be because, certainly it is partly by this, we have increased inflammation of the blood vessels and also in the body in general, and increased viscosity or thickening of blood, which makes it more prone to forming clots. And some of the studies have said that this propensity lasts about 3 years after infections. But I just completed research on a book on long COVID, which is a complication you might see of COVID where there are persistent symptoms that can last decades, including increased risk of cardiovascular disease. And then there's alcohol. So we have young people using, and abusing too much alcohol, certainly on college campuses. Half of rapes and sexual assaults on college campuses are those that are inebriated at the time. So alcohol is bad for lots of reasons. We also know, and you can listen to one of my podcasts on alcohol where I talked about the 7 cancers that are known to be increased by alcohol consumption, and how the American Cancer Society and other organizations have said that there is, and I'm paraphrasing, there is no amount of alcohol that does not increase one's risk of breast cancer, and it probably increases risk of other cancers too, which we know it does. So in terms of substance abuse, we're talking about alcohol and tobacco and vaping, and of course cocaine, even marijuana, because you can't have anything. But hey, in some people, these will all increase risk of cardiovascular disease, a hardening of arteries, which is atherosclerosis, and triggering cardiovascular events like stroke. And what about racial and socioeconomic differences among young people? Well, we know that there are racial and socioeconomic disparities, which seem to be associated with stress from discrimination, whether it's real discrimination or perceived. It doesn't really matter. The body's going to take it but pretty much the same way, and that's not in a good way. Also, there's poor access to care in poor racial groups, and neighborhood inequalities and access to medical care. All of these things exacerbating the risk of early onset diseases. And then missed findings. Many young adults underestimate their risks. Nearly half of younger adults that have been surveyed in some studies don't consider themselves at increased risk, and clinicians often miss early warning signs. They certainly do. I've had many young clients that have come to see me with severe issues that were initially simply missed by their doctors because their doctors weren't thinking of considering these issues, but now things have changed, so you might have to let your doctors know. In terms of early prevention in the form of controlling blood pressure, a healthy diet, regular exercise, sleep quality, all of these help to control and lower one's risk of all-cause morbidity and mortality, not just from cardiovascular disease. And you might be thinking, well, what do I do to manage my blood pressure and my diet, and what sort of exercise should I do, and what is good sleep quality actually mean? So you might have to see someone like myself, a trained health professional that hopefully has a doctorate that's allowed based on the scope of practice to order laboratory work, because if you have a nutritionist like a dietitian compared to, let's say, a dietitian that has a doctorate that can read laboratory work, you're going to get better care, generally speaking, if you can look at your chemistry to figure out your unique needs. And in terms of unique needs, when I interview a client based on a careful medical health history, I will do testing, by the way, that you'd find in many different medical specialties. That's what I do in terms of my blood detective lab approach, where you might have to see a half a dozen or more different practitioners just to get these tests done. And some of the doctors simply won't do them. But they're important nutritional tests and holistically oriented tests, along with some regular types of testing that you're all familiar with getting. And based on that and careful conversation, I put together a personalized plan for someone. And then we want to get some baseline labs, and if there are abnormalities there, we want to allow the appropriate period of time to recheck things to make sure that your efforts are working. Lots of people I know begin what seem to be on paper really good healthcare plans, and they never check their progress, and it doesn't always work. It needs to be adjusted, so very important to consider that. So thanks for attending this presentation today, and I will see you at the next podcast. Thanks so much, everyone.